So when you're running a paid ad campaign, there are a few KPIs that you should be shooting for. Let's just take, as an example, a $1,000 ad spend budget a month. Very reasonable ad spend budget. You should be generating between 50 and 80 consultation requests on average for a $1,000 ad spend budget per month. Now, if you're getting people seeing your ads, but they're not clicking your ad, that's a messaging issue. Start looking at what images you're using, the title of your ad, or the body text of your ad. It might not be resonating with people. You need to change up your messaging so it resonates with your target audience. If people are clicking your ad, but they're not requesting a consultation, that is also a messaging issue or possibly a call to action issue. People are confused after clicking your ad. They don't know what information you're looking for. They don't know what their next steps are. And then finally, if they're clicking your ad, they're scheduling a consult, they're showing up in your office and they're not moving forward with treatment, that is a case presentation issue. That's a training issue. You need to analyze what's being said and what information is being presented in what way to the patient to make them not want to move forward with treatment or a home sleep test or whatever their next step would be. Hopefully that helps. Try those out. Hopefully those should be your points of data to help you make the best decisions possible with your marketing campaign.